Hey there, and welcome back to the channel. Today we're diving into a powerful part of every home health assessment that goes way beyond the physical, the psychosocial assessment. Psychosocial assessment is crucial for identifying psychological and social issues, monitoring mental health conditions, and providing appropriate interventions and support. It aims to promote mental and emotional well-being, identify mental health issues, and provide appropriate interventions in the context of the patient's home environment. Start by assessing the patient's emotional and psychological state. Ask open-ended questions like, how have you been feeling emotionally since coming home from the hospital? Or, do you feel overwhelmed managing your care? Watch for signs of depression, like withdrawal, sadness, or flat affect, anxiety or restlessness. For cognitive changes such as memory lapses, confusion, poor concentration, any history of mental illness, trauma, or hospitalization. Identify any challenges or limitations related to psychological symptoms. Assess the presence of suicidal or homicidal thoughts and ideation. Monitor for signs of increased risk and implement appropriate safety measures if necessary. Identify signs that need immediate referrals to social work, behavioral health, and that needs reporting to the ordering physician. Next, we dig into who's supporting the patient and what that support really looks like. Assess coping ability and support system. Ask, do you have someone helping with meals or meds? Are you satisfied with the help you're receiving at home? Evaluate caregiver presence. Are they reliable, burned out, signs of strained relationships or conflict? Isolation, especially with elderly patients who live alone. Any signs of neglect, verbal abuse, or tension in the home? If the patient hesitates to speak freely, pay attention to body language. That alone can tell you there's more going on than what's being said. Psychosocial isn't just about emotions, it's also about the environment. Observe cluttered or unsafe spaces, lack of food, hygiene, or clean clothing, accessibility, stairs, grab bars, lighting. Then ask, do you feel safe in your home? Are you able to get to the doctor, grocery store, or pharmacy? Evaluate the patient's social support system, including family, friends, and community resources. Assess the impact of social relationships on the patient's mental well-being. Social determinants like housing instability, food insecurity, and transportation issues are often the root of non-compliance, not patient unwillingness. Assess how the patient receives and processes information. Can they read and understand care instructions? Do they speak English? Need an interpreter? Can they identify their medications or demonstrate how to use equipment? A patient's health literacy is essential. If they're nodding along but can't explain the care plan back to you, that's a red flag. Even if they're insured, ask, have you had trouble affording any of your medications? Do you have help paying for utilities, food, or transportation? Patients often hesitate to admit financial hardship, but it's one of the most common reasons for missed doses, skipped appointments, or delayed wound healing. Be gentle and non-judgmental. Lastly, cover legal and ethical concerns. Are advanced directives in place? Is there a designated power of attorney? Does the patient have capacity to make decisions? Do you suspect any abuse, coercion, or self-neglect? Assess need for a social worker to assist with placement with community services and resources. If anything feels off, document and escalate per your agency's protocols. Use standardized tools to assess memory, orientation, and other cognitive domains. These are often embedded within the software your agency uses for assessment. Examples of common tools used are PHQ-2 and PHQ-9 for depression screening, GAD-7 for anxiety, MMSE or MOCA for cognitive assessment, Columbia Suicide Severity Rating Scale, CSSRS, OASIS Functional and Mental Health Items, Geriatric Depression Scale, GDS, Confusion Assessment Method, CAM. Use and effectiveness of psychotropic medications and compliance with these medications. Monitor for side effects and report findings to MD. Reconcile medications and assess patient and caregivers' knowledge of medications and proper administration. Assess availability of the meds in the home, financial ability to obtain medications, and ability or availability of someone to pick medications from the pharmacy. Assess need for assistance with medication administration. Assess need for a pill box to promote compliance. Identify current stressors and challenges the patient is facing. Assess coping mechanisms and provide guidance on healthy coping strategies. Evaluate the patient's overall quality of life and satisfaction with various aspects of their life. Identify areas for improvement or intervention. Assess the patient's willingness and ability to engage in therapeutic interventions, such as counseling, psychotherapy, or support groups. Provide education on mental health conditions, treatment options, and the importance of adherence to therapeutic plans. Educate caregivers on how to support the patient's mental health needs. Assess the patient's risk for self-harm or harm to others. Develop safety plans and involve appropriate professionals if there is an imminent risk. Communicate with psychiatrists, psychologists, social workers, or other mental health professionals involved in the patient's care. Collaborate on treatment plans and adjustments to the therapeutic approach. Is the patient exhibiting psych symptoms such as aggression, confusion, irritability, hallucination, mood swings, etc.? Is your agency psych certified, or are you a psych nurse? If the answer is yes, then follow protocol as provided by your agency or contact your agency's case manager immediately for guidance if unsure. Under Medicare's Conditions of Participation for home health, psychiatric nursing is covered if the patient is homebound. They require intermittent skilled nursing care. The care is reasonable and necessary, related to a psychiatric diagnosis or mental health need. The service must be provided by a qualified psychiatric nurse. A patient with a psychiatric disorder is considered to be homebound if his or her illness is manifested in part by a refusal to leave the home, or is of such a nature that it would not be considered safe for the patient to leave home unattended, even if he or she has no physical limitations. The following conditions support the homebound determination: agoraphobia, paranoia, or panic disorder. Disorders of thought processes wherein the severity of delusions, hallucinations, agitation, and/or impairment of thoughts or cognition grossly affect the patient's judgment and decision-making, and therefore the patient's safety. Acute depression with severe vegetative symptom, psychiatric problems associated with medical problems that render the patient homebound. The services of a skilled psychiatric nurse must be required to provide the necessary care, such as observation, assessment, teaching, training activities, management and evaluation of a patient care plan, or direct patient care of a diagnosed psychiatric condition, which may include behavioral and cognitive interventions. Examples of covered psych nursing services include monitoring and teaching related to psychotropic medications, managing medication side effects, providing crisis intervention and safety planning, supporting medication compliance, assessing and addressing behavioral issues that affect medical outcomes, therapeutic communication, support, and psychoeducation. Who can provide psych nursing in home health? The psychiatrically trained nurse must have special training and/or experience beyond the standard curriculum required for a registered nurse. The RN must meet one of the following criteria: a master's degree with a specialty in psychiatric or mental health nursing, a bachelor's degree with 1 year of recent nursing experience, or a diploma with 2 years of recent nursing experience recommended within the last 3 years, and licensed in the state where practicing would qualify, with experience in an acute treatment unit in a psychiatric hospital, psychiatric home care, psychiatric partial hospitalization program, or other outpatient psychiatric services. The services of a psychiatric nurse are to be provided under a plan of care established and reviewed by the treating physician. Medical social services may be necessary to resolve social or emotional problems which are, or are expected to be, an impediment to the effective treatment of the patient's psychiatric condition or rate of recovery. Coverage for social worker visits may include, but are not limited to, the following: assessment of the social and emotional factors related to the patient's illness, the need for care, response to treatment and adjustment to care, and the response to treatment, including patient's financial resources, home situation, and the availability of community resources. Counseling services for the treatment of patient's psychiatric condition, e.g., psychotherapy services, brief counseling of the patient's family or caregivers when they are reasonable and necessary to resolve problems that are a clear and direct impediment to the treatment of patient's illness or injury, assistance with obtaining available community resources to assist in resolving the patient's problem. Key risk areas to monitor are suicide risk or escalating mental illness, medication noncompliance due to cognitive or financial barriers, self-neglect or caregiver burnout, co-occurring substance use, abuse or unsafe environments. It's important to understand that Alzheimer's and dementia by themselves do not qualify as psychiatric diagnoses requiring psych nursing. Most home health agencies manage these conditions through skilled nursing care, unless behavioral or psychiatric complications arise. It is also important to remember that a psychiatric diagnosis doesn't have to be the main focus of the care plan for a psych nurse to be appropriate. Intervention may be needed based on secondary mental health concerns. Keep in mind that requirements for psychiatric services may vary from state to state. Always check your state's specific regulations and follow your agency's policies and procedures. Thanks so much for watching. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop. Link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you. And feel free to share this with anyone who might find it useful. See you in the next video.